I am Grace Norman, and I am a professional triathlete for Team USA. I am a 2-time Paralympian and training for Paris this summer. I have a full set of medals, gold, silver, and bronze from both Rio and Tokyo, and looking to take home a gold in Paris this year. When I was a kid, I actually wanted to be a doctor when I grew up. My mom's a doctor. I thought doctor was amazing because I grew up with that medical influence. And never did I think that I would become a professional athlete. I was born with a congenital condition called amniotic band syndrome. Basically, that's part of the amniotic sac that gets around a limb in utero and cuts off circulation. Ultrasounds weren't as good as they are now, so my parents did not know that I was missing a foot. Prosthetics are very important, especially for an athlete, but everyday life. I can't live my life without it, and finding the right ones to match your different activities in life, a different one for cycling, a different one for running, they all matter. And my athletic journey, I feel like didn't really start till I got the right prosthetics, which I wasn't until I was in high school. But when I received that first athletic prosthetic, specifically a running prosthetic, my whole life opened up and changed. I was able to actually be fast.
I could tell she was driven at what she did, and I like that competitive person, somebody who wants to get after it and take hold of her life. So I was excited to meet somebody who was kind of forward thinking like that and wanted to pursue new things.
As an athlete, you're always going to have different challenges, especially an adaptive athlete. Low iron can present in several different ways. For me, I really wasn't feeling many symptoms except I had some heavy heart palpitations and wasn't really able to live life normally with it. I have recently started working with UF Health. They are a new National Medical Network facility with the USOPC and for Team USA.
So here at UF Health, we're really staying at the forefront of how to best treat iron deficiency with or without anemia based on evidence-based medicine. Grace and I decided that we really needed something that helped her improve her iron levels quickly and effectively, which is why we chose intravenous iron. Iron is one of the building blocks to make red blood cells. Red blood cells carry oxygen to tissues. And so if you don't have enough red blood cells or you're anemic, that can severely affect any person, but particularly an elite athlete who's competing and using high-intensity training. So it would not only affect her performances, but her quality of life as well.
I've really loved working with UF Health and Dr. Raja Shekhar. She's been very instrumental in my care in the last few months. The palpitations have subsided since being treated. I kind of come back when the iron levels dip, and then we get another infusion and we're back on the road. What I like to tell people who are dealing with different challenges in life is community is going to be your best friend, and finding resources that are going to build you up.
It's exhilarating to watch her compete. It's fun to see my baby doing what she loves. I just love watching her doing her thing and smiling when she comes across the finish line.
Future goals in sport is to continue to raise the bar in international competition for Paralympians like myself, athletes with disabilities, and just continue to forge the way for that.
She's really a role model for young girls, women, Paralympic athletes, and many others. And so I feel like if I'm part of this pit crew that's helping Grace perform at her best, I'm not only helping her achieve her own dreams, but maybe we're inspiring other athletes to pursue their dreams.